There we go.
We're live.
Good morning, everyone. Welcome to our meeting. It's good to see all of you. As we always do, we are starting at 9:45 or a little shortly thereafter. And what we've been doing is giving folks in our in the community the opportunity to address the council, through via the Zoom meeting. And so before we get started with that, however, we'd like to just introduction of any of the designees and who are they representing. So I'll call them out because I see them all on my screen, and then I'll make sure we all know who's here for who. So Enrico is here for.
Good morning. I'm actually generally observing, and I substitute for Commissioner O'Malley when she cannot make it, but I see that she's here today.
All right, very good. And so then, good to see you, Julie. Morgus Baca from the county manager. Commissioners Piscotti and Commissioners O'Malley are both on. Appreciate both of you. Councillor Benton and Councillor Davis are both on. Good morning to you. Let's see. So Terry, are you in for the president?
Hello, Chairman Rael. Yes, sir. She's at a Health Sciences Center meeting. I think Dr. Richards is as well. So.
All right. So that would explain our friend, Ms. Chamisa Pacheco. Are you in for Dr. Richards?
Yes, sir, I am. Good morning.
Good morning. And then Deb Brazan is on as well. Deborah Brazan, who was our staffer here monitoring. And also Doug Chaplin, for those of you who are maybe have all the screen, is also with Family and Community Services. And so I think we've got everyone. The mayor will be joining us here shortly after the public comment period. So at some point, I'll be turning the gavel over to him. But with that being said, let us go then to our public comment period, if you will. And as usual, we do accept written comments, and the agenda was basically distributed and made available on Friday of last week. We did receive one comment, and I think many of you have them in your packets. I'm going to turn over to David to see if there is anyone else lined up for public comment.
I have not received any other requests for public comment. Just to confirm, do you have any either?
No, sir.
Okay. So the way this works for those who may be observing our meetings today is anyone is welcome to sign up, and we'll give them up to 1.5 minutes for public comment in front of all of our committees, including the full coordinating council meeting, which is what we're doing today. But we'll give them a couple of more minutes, members of the council, to see if anyone else is signed up or signs up here. So if you will. In the meantime, if we might just go through the agenda. All of you have done a chance to look at the agenda, I'm sure. Are there any additions or changes to the agenda? As any of you see them? Okay.
Do we need to say the WEC edition?
We will have a little presentation under next steps, under other discussion from Carol, our Director of Family and Community Services, on the latest updates on the West Side Emergency Shelter and some of the challenges we've encountered of late with COVID-19. So I just want to give you all a sense that we'll have that conversation here in a few minutes. And anybody else signed up, David?
Nope.
Nope.
So nothing.
Okay. Well, then what we will do then, members of the council, with your concurrence, if other folks sign up here between now and 10 o'clock, we will try and let folks in to share a comment or two, depending on how many folks show up. Otherwise, just in earnest of saving time and giving you all some information, I'm going to go to Carol and have her talk to you about the West Side facility first and give an update as it relates to COVID-19, just because it's not an action item, but I think it's an important item for you all to have a general sense of what's happening at the West Side as we speak. So, Carol.
great. Thank you, Lawrence. I think the moment came that we've all been prepping for some time. And so as of last week, we have 91 positive COVID cases. And we've continued our practice of screening everybody daily and following our processes there. And with the rise of cases in our community, we're seeing the rise at the West Side. And so currently that 93 also includes 11 staff members who we've made accommodations for to be safe and be taken care of. And so we've also, between the city and the state, we continue to have non-congregate settings available as we are distancing people in their recovery and to keep them safe. At the moment, the West Side is closed to new people. They are calling 768 help, and we are working very succinctly and carefully with our community partners to get people housed as needed. We're making preparations this week to do some community testing out there in the community for those that are unsheltered in our partners, and some partners have increased their testing. We're seeing roughly a 30% infection rate, which is about half of what other congregate shelters see around the nation. So we're glad for that, but it's a high rate. So that's why we're working with our community partners. And just really for Terry and Shamisa, I really want to say the partnership that we established long ago with the university pays dividends daily. Our appointed medical director, Laura Pajaron, is leading us, working very succinctly with the state and with our medical team there. And we've just got a great team, and I think that's why we were able to go swiftly into action this weekend. And just really want to acknowledge the family and community team that has worked tirelessly as well, and Doug Chaplin is really a key lead in that as well.
Okay. Any questions for on this issue for Ms. Pierce from anyone? I think the only other comment I would make as it relates to this is that it's been, like she says, a great teamwork to get this done. We don't know how things are going to continue to go here in the next couple of weeks as it relates to COVID-19, but it certainly has been a team approach. But I do think that this also does amplify, if you will, the issue that we need to do as we start looking at how we work on long-term care for our homeless population, that we need to have some of these medical services located in facilities that are closer to town where we can triage these a little better and work through them. So anyway, we'll continue to have that conversation as we move through the next couple of months. So with that being said, David, do we have anyone else signed up?
Let's see. Not through the registration, but we do have someone in the chat.
Okay, we do have a chat. I think all of them are able to see that. Is that right?
All of our, yeah.
All of our community. So you all have seen that. So let's go ahead and let
Albuquerque Friends.
Albuquerque Friends in so that they can address the HCC.
You want to tell them?
Good morning. Shall I speak?
Good morning. Can you identify yourself? Just
Absolutely. I can't see myself, so I'm hoping I'm on screen. My name is Sarah Malone. I am a member of the Albuquerque Friends meeting, and I am co-clerk of the Sanctuary Task Force, also member of Building and Grounds. We are in a location where there are many unhoused people in our neighborhood. Recently, we received a citation because of some individuals who set up tarps overnight in early September when we had that huge freeze or very low drop in temperatures and wind and rain and so forth.
Hey, Sarah, can I interrupt you for a second? Just wanted to let you know, we'll give you a minute and a half for public comment for everyone. So in fairness to everyone, we'll start the clock now for you. So
Okay.
go ahead.
Yeah, so my question is this. As a faith community, we are doing all we can to provide some water and some very minimal support to unhoused people, also encouraging them not to stay on the grounds overnight because we know it's against zoning However, it's very difficult when we know the West Side Shelter is now closed, and individuals have told us from the beginning that they are wary of going there even before these outbreaks. With the onset of winter in particular, we're wondering, can vouchers be made available? Where do we suggest people go? We're very concerned about their safety, particularly in the winter. We've been cited for having people camp even when we've asked them not to. People still do sometimes do so, even though we now have an on-site resident. So we're concerned about their safety. We're also wanting to, well, follow the rules that you're setting to the best of our ability, but are very concerned about the welfare of the in-house people.
Okay, thank you, Sarah, for that. And so I think our Director of Family and Community Services will address your question very shortly. And then we can have an aligned conversation so that we can move forward with additional public comments. So.
Sarah, thank you. And we appreciate the conversations we've had with the Friends Meeting House and appreciate your perspective from a faith-based lens. Right now, we are encouraging those that can to reach out to 768-HELP. But as we're working with everyone, our providers in the community, as they're getting food at noonday or they're getting services at HopeWorks, that we are connecting with people as they are requesting to connect them to vouchers or other places as needed. And we're doing that through our network of our providers. Sebastian, who's continuing to do outreach, and there is very aware of our current status of the West Side. And I just do want to add that it is temporarily closed as we get on top of this spread of infection, but we will keep everybody posted as that can become open again.
All right, thank you, Sarah, for your comments. Do we have anybody else online, David?
We do not.
Okay. All right, well, we are now at 1 minute before 10, so maybe we can go then to approval of the minutes for the September 29th meeting. If any of you have seen the minutes and have gotten a chance to go through them, we need a motion for approval.
So moved.
It's been moved by Ms. Julie Baca. Do we have a second? Second by Commissioner O'Malley. All right, so David, would you please call the roll for the approval of the minutes?
Yes, let's see here. Lawrence Royale,
Yes.
Commissioner Piscotti,
Yes.
Councilor Davis,
Yes.
Councilor Benton,
Yes.
Commissioner O'Malley,
Yes.
County Manager Morgus Baca, and latest Terry Babbitt,
Yes.
and Dr. Richards.
That's Chamisa.
And Chamiza, I'm sorry.
Yes, I'll try and make my voice a little deeper.
Sorry about that. I apologize. Yes, that's everyone.
All right, very good. All right, thank you so much, everyone. Our next item is discussions on the coordinated community-wide framework. We all sent this out, I believe,
Last night.
and it really, to many of you who have been on the committees and have been working on this, you can sort of begin to see that this is a culmination of all of the work that have been done by the committees over the last couple of months. So I'm going to turn it over to Carol to go through it in a very general way. And I think what we'd like to have today is to have a conversation with all of you on the council as it relates to this, where we want to go. I think this is the kind of conversation we talked about early on about looking at our needs and gaps, and then our high impact strategies, and then start to look at adopting this as a framework that we can work through as we move forward. So with that, I'll turn it over to Carol and have her walk us through this.
Thank you, Lawrence. I think the document as it is, pages 4 through 20, are all the parts of the 5 committees that they presented last week. I think where I would really like to start is on page 3, the introduction that really helps frame it. So just as a refresher, the agreement that was signed among all the organizations asked for a coordinated community-wide framework. And what we agreed to, what the council agreed to, is to identify the high impact strategies as well as what the needs and gaps that needed to be addressed. So that's what is contained in this document. What we've highlighted in the introduction to frame this and give context is to acknowledge that while all those high impact strategies identified from the 5 committees, highly important, they're, as we use the words, aggressive and ambitious, but many of them can be ready to go, but we do have a capacity issue in our community in terms of the number of behavioral health providers or the infrastructure in our community to administer additional housing vouchers as it stands today, affordable housing units and the capacity to develop that, as well as our nonprofit providers to administer additional emergency beds. So it's not that we can't overcome these challenges, but we really want to frame this document that there are some capacity challenges. And so I think as the council continues to discuss this, then the next steps is the council, I think, needs to give us guidance on what is the time frame to then detail out the high impact strategies by each of the committees, which would include some dollars and some timeframes to administer that, and to acknowledge if there are gaps in the community that might prevent them from being administered. So Lawrence, we can go through the remainder pages, but I mean, this is what the council has seen before.
So let me pause there for a moment and ask any of the committee members if they have any thoughts about what's just been presented, and any perspectives. Okay. Well, if that's the case, then
Lawrence?
Yes.
Lawrence?
Okay, Commissioner, go ahead.
I'm sorry, I couldn't find the chat button right away, or the hand raising button or whatever. You'd think I'd get better at this. I'm really glad that Carol opened with the capacity issue. And I think that's important that the public also knows that, we recognize that, and that is, it doesn't, I think sometimes people feel like something, that some of the funding has to go directly to the, to the individual. But in this case, we really need to put a lot of effort and resources to the people who are helping these individuals and getting, because it's not as simple as, especially if you're trying to house people who have a lot of issues and putting them in an apartment, because they need all the support services to be able to be successful. So I think that's important to recognize the capacity issue, and it's not inexpensive. And it'd be good to know a little more about what's likely, and I guess we're going to be talking about that. How do we, when we start to get up to that capacity, what's that going to take? How long would that take to get to the capacity we need? Thank you.
Thanks, Commissioner. I think your comments are apropos. Look, I think that the issues with all of these capacity issues or this situation is that we've got to now drill down on those issues, in particularly, the administration of the housing vouchers. How do we scale that up so that we can get more of those dollars out the door? How do we look at affordable housing units, and how do we scale any of these things up? And then there's always the question of the operating costs associated with the work on any of these. So there is that conversation that needs to be had, and I think that's why this introduction gives us a sense that we've got some additional work to be done on some of these particular areas. And you're right, Commissioner, these aren't easy issues to deal with given the magnitude and complexity of the problem. Anybody else have any other questions?
Lawrence, it's Pat.
Counselor Benton, Davis.
I'll be Counselor Benton too. He's pretty smart on this stuff. But no, thanks. I just want to say, in talking about the vouchers really quickly, I realize this is something we need to talk about in greater depth, and I really do appreciate, as frustrating as it was to learn that we weren't able to get as much money out the door as we needed to. I really do appreciate Carol and her team and the family and community. I met with them over the holiday. We brought in some new folks to really triage how to work on this. I know she's got a meeting tomorrow with some of our providers about how to move that forward. But I want to say, in the 2 years we've been really focusing on this is the first time I've seen it all in one document sort of laid out. And I do appreciate that because I think it gives us a guidepost for sort of common understanding of what the data looks like and what the resources are. And quite frankly, I think this is a good place as we come to a close for this advisory committee. It's good that we have this data. But I just want to acknowledge, from the city side, or at least from my side as one piece of the city council, before we can ask for our partners to step up, like UNM or the county, to step up and help us solve this problem, I appreciate that we're recognizing that we have to do our part to get our piece together and take that first step if we're going to be a leadership agency or a leadership partner in this. And so I appreciate what Carol's working on. I'm excited to see that. But I agree with Debbie, with the commissioner. We now know that we have to create more supply in the community. I think the city has the resources to make a big dent in that if we can do it quickly. And I'm hoping that our partners, if we look at this data and they see us taking a big chunk, they'll commit to doing the same. And ultimately, that's where we have to get, if I'm right, Lawrence. This is sort of a guide, but ultimately, this has got to come down to something where everybody's got to put something on the table. Is that right?
Counselor, that's correct. That's exactly the framework that I think all of us have been working on, and appreciate your comments as it relates to helping all of us get involved and deal with the issues from where we sit and from what we have and from the resources that we all have to make it work. Anybody, Counselor Benton, you had your hand up as well. Would you like to ask something?
Yeah, just quickly, Lawrence, I agree with everything that's been said. I've kind of got my cow chair hat on right now since we're working on the operating budget as we speak. And with regard to the capacity issue, I think each of our partners and ourselves obviously have the ability to raise capital and operating funding. And I think, probably the next step is going to be, that's the tough one, right? Start putting some hard dollar costs on our priorities and getting to work as each entity to put up, put up what we can towards those highest priorities. So I'm looking forward to that.
Okay, thank you. And I might just add that the mayor is now joined us, so I'm going to turn over the meeting to him to continue the conversation. So, Mr. Mayor, it's all yours.
All right. Well, thanks, everybody. It's good to see everyone. And, I think we were progressing down the agenda. Obviously, we had this down as a other item to discuss down at the end, which we can go back to it then if we need to. But I do want to highlight, if it wasn't mentioned already, we do want to save a little bit of time to talk about the outbreak at the shelter. So we have that now slotted in down at the end at other items.
So we actually moved that forward, boss.
Oh, you did?
Yeah, because we were waiting for public comments. So we had some time. So.
All right. Well, let's move on to the next agenda item then.
So where we are right now is we're talking about
Framework.
Got it. So proceed.
All right.
Yeah.
So we'll give the boss a bit of a chance to get up to speed on where we are right now. But any other thoughts on any of the committees all have their information listed here. And I'm going to have Carol just highlight each one so that way you all get a sense of what's there. And then if you think that there's something that's missing or something that needs to be added, this would be the time for us to, and we're not going to do it this very minute, but within the next couple of days, because we want to get this project, at least this portion of our work finished. So Carol, would you lead us to the rest?
Yes, and I think based on the comments today and the last paragraph of the introduction, which many council members have emphasized, as I go through the high impact strategies, our next step would be to prioritize those, to estimate operational costs, to identify is there a capacity issue and specific targeted dates. So I think our next step would be to do that on these high impact strategies. So on page 5, we led with the services committee. And this is the document that you saw last time. I mean, overall, we have a deficit of emergency shelter beds. And what this strategy does is it identifies by population the need for shelter. And it specifies many of the parts and pieces about storage, about food, about pets, about having housing coordinators. So I really thank the services team that have detailed that. And what's also important on the services committee that is very consistent with their charge is, as we have more emergency shelter beds in our community, what are the strategies to minimize neighborhood impact? We've had neighborhood representatives on that committee. That's been extremely helpful. And those strategies are discussed here. I do want to emphasize, I know there was some recent conversation. This remains a draft document, and it will continue to be living, breathing is the word I like to use, as the committees move forward to prioritize in detail as other pieces of information needs to be added. Mayor Lawrence, I can pause there. We want to see if there's questions before we go to the next committee, if you like. And maybe just with all due respect, Commissioner Piscotti is one of the co-chairs. We've got Quinn here as well, if they might want to add to any of that.
Commissioner, want to add anything?
No, I think that really summarizes it. I think our subcommittee's been great at really, I guess, really caring about these different populations and seeing what services are needed for the populations and for the neighborhood. So I think, yeah, everybody's doing a good job.
All right, Quinn, you want to add anything?
I am all good, thank you, sir.
Okay.
And I think I'll just add, and Lawrence said this earlier, I think what we're all collaborating on and dealing with that at the West Side just highlights having a facility 20 miles outside of town has made the management of this increasingly difficult. And even as we were driving back and forth with the stand-up centers we made in town to go out there, it would easily take an hour out of all the professionals' days as we were trying to manage this. So this strategy really emphasizes smaller shelters, more centrally located so people can access services here in our community. So the next, I think we have the facilities is the next committee. And on that, as we saw before, there are multiple strategies being looked at. Gibson Medical Center as an existing facility in our community that is recognized as a health facility could offer potential space to fill many of those gaps on behavioral health, addiction treatment, as well as emergency shelter and beyond. The West Side Emergency Housing Center, as we move forward, will need to remain as part of that system response for people without homes. And we would want to continue to supplement as we can out there with our medical clinic and other facilities. As we've also talked about, we have many providers in the greater Wells Park area. And so there is a need for some emergency shelter and medical respite for the north of Lomas area. We didn't emphasize it in the prior report, but there's been a lot of really great conversation on medical respite and how there is a pretty gaping hole in our community to meet that need for people without homes. Also, as consistent with the services committee looking at populations, so did the facilities committee looking at for women and children, and that's a unique population. And so that's identified with some of the support services listed underneath. Young adult and our young adult shelter committee for housing with great university leadership, as well as county and with Quinn. Lots of excitement and good ideas about a young adult facility. There is also a gaping hole in our community to really help those youth 18 to 24, which covers UNM students that may be shelter fragile and trying to pursue their education. There's been discussion in that committee also about sanctioned encampments. And what does that mean when we do have people without homes that choose not to seek shelter, and to explore that further? Tiny homes, which we've seen successfully launched in the Southeast Heights with Commissioner O'Malley's leadership, and what might that mean if we were to expand it? And then just continuing, we can never overemphasize the importance of the system here in Albuquerque, working with our providers, and how can we support them as they want to expand their facilities to respond to the need. So with that, I should pause to see if there's comments on facilities.
Sure. I would just add a couple of things. This group's been working very hard, and we're going to have, I think, really want to focus the next meeting on facilities. And so we'll have some updates with respect to some concepts and different land spots in, the Wells Park area, but also some details around like what this would actually look like with respect to the old Loveless facility. So just as kind of a heads up, I think that'll be the bulk of the meeting in 2 weeks. And so you can anticipate a lot of details, and we can dive into Q&A and all that probably better at that point.
And Mayor, if I might add, Commissioner O'Malley, we have set up a briefing from the folks in Las Cruces for our next facilities meeting, which will be next Friday, a week from this Friday. So that we can so that the facilities committee can get a briefing on what they are doing in Las Cruces as it relates to encampments.
Okay, should I just wait then, Lawrence, to have some comments?
It's up to you, Commissioner. We certainly will have more details at that
Okay.
meeting.
Okay, I did want to delve a little deeper into facilities, and so I can just wait on that.
Okay.
Sounds good.
Councilor Benton.
Go ahead, Councilor Benton.
Just quickly, I was pleased to see on the North Downtown facility what I consider to be kind of a key point there, and that is the consolidation and coordination of supportive services. I think that second word's supposed to be coordination, or consolidation and coordinated supported services. I think that's a real key to that. That's an important bullet point, because we know a lot of services are being delivered there already. And if we come in with a new facility of some kind there, which I don't disagree that the new facility of some kind makes sense there, that we do need to ensure that we're not adding somehow to a critical mass of people who are just wandering between facilities in that area. Thank you.
Mm-hmm. Mm-hmm. Other comments on this section? Okay.
Great. Moving on to coordinated street outreach, and we've got Xochitl Campos Biggs here in the room, as well as Commissioner Cawley's been a co-chair, as well as Dr. Lynn from UNM. A really robust committee with great conversations, skipping past the needs and gaps, which are always important, but we're zooming in literally to the high impact strategies. So this group is talking about finalizing, and it's good because a lot of this work has been going on. This is just kind of packaging it together. So it's finalizing a street outreach agreement by all the street outreach providers. So really, as they continue to refine, focus, coordinate their work, really addressing the needs of people on the street. I think it's great talking about a shared definition, because outreach sometimes has different meanings for different groups. With Xochitl and the other co-chairs' leadership, a survey has already been launched to really understand a little bit more deeply about some of the needs and that coordination, and that's already underway. And what will really support this group of providers is a coordinated framework, if you will, or a model for coordination and how they can work together, as well as extend the limited resources we have on street outreach. One of the recommendations that's been here for a while is to fund a street outreach coordinator that could really take on some of this oversight and coordinating. We don't really believe that necessarily should be a government position, whether that's city, county, or UNM, but rather that could be funded by a provider in the community. But that kind of coordination and oversight by that coordinator could be a really important strategy. So I think Lawrence and Mayor, I think if Sochi or any of the co-chairs, I'm not sure if Commissioner Colley is able to be here today, or Dr. Lynn, if there's anything they would want to add.
I'm adding Commissioner Colley.
Oh, great.
Oh, Commissioner Colley's coming. Stand by.
But I do not see.
Yeah, and Commissioner Colley has barking dogs in the house, so I apologize for that. Carol, thanks very much for that introduction, and thanks to Sochi for writing all of this up. I guess I just want to say that the word finalized, with which this high impact strategies page begins for us, is somewhat amusing to us. Because everything is evolving, and the longer our writing committee talks to each other, the more we understand that we don't understand, and the more we understand is going to have to change. So, you know, we are at a 60-day mark. It'll be interesting to see what changes happen at the 120, 180-day mark as we begin to try to solidify things. So I enjoy the word finalized there. That's only for the purposes of a 60-day report. And please know that all of this stuff continues to evolve. It's a fast changing scene.
Sochi?
Yes, and just to piggyback on
Here, come on up.
And just to piggyback on Commissioner Colley's comments, it's the priority of the members of the Coordinated Street Outreach Group that this exists as a living document. Like Commissioner Colley said, outreach is something that constantly is evolving and responding to change. The COVID pandemic is an excellent example of that. And so, so we hope to continue our meeting long into the future. So thank you.
Great, and I don't believe Dr. Lynn was able to be here today. Okay.
Councilor Benton does it.
Oh,
Okay, Councilor Benton?
Yeah, just quickly, under the needs and gaps, the bullet that jumped out at me, and this is because I just ended a meeting with some of the downtown business people and the downtown public safety district about this exact issue. People experiencing homelessness who are experiencing a mental health crisis need quick access to psychiatric services. I think this is really a key point right now. It's sort of an emergency situation downtown now because of the issue with the pandemic at the shelter. And really the only people left downtown with some of the folks who are really having a major psychiatric event, but they're on the streets of downtown. The only people left to deal with some of these individuals are the police downtown. Even Albuquerque Street Connect, which has had some good, pretty good track record with some of these folks. Some of them, Albuquerque Street Connect will not serve because they're just, they're too volatile. That is a real critical need and probably a growing need that I just want to point out, but I appreciate the fact that that bullet is in there. We've really got to tackle that one. And there were a lot of discussion at that meeting this morning about, what can we do with regard to a 72-hour hold, or what can be done to help these people who are really in a crisis mode, but they're also potentially dangerous to to the wrong people trying to help them.
Mr. Mayor, this is Jim Colley. I think it's important to answer Councilor Benton's very astute observation. We are, through the Behavioral Health Initiative in the county, trying to increase the number of clinical teams that can respond to those kind of crises. We have a few, they're operative, they're used. It's important that we have them, but we also acknowledge exactly what Councilor Benton is talking about. And our plans for the future are to try to increase the number of teams that can respond to those kind of situations.
Thank you for that, Commissioner Sochi.
Yes, and just thank you, Councilor Benton and Commissioner Colley. Just kind of in response to your comment, Councilor Benton, especially when it comes to the 72-hour holds and psychiatric emergencies, we are very lucky to have Dr. Denise Lin from UNM Psychiatry in our coordinated street outreach committee. And part of some of the strategies that we're also working on is making sure that we're including those social workers who are part of that discharge process in the emergency rooms in part of our conversation. We see that as a big gap as far as that communication goes, and we're working on addressing that actually as we speak. And so I appreciate you meeting with the Downtown Public Safety District. I know that they work really hard to meet those needs, and there's just a lot of opportunity, and we hope that we're exploring all of it. So thank you.
Thanks, and actually this is a good one. A good point to just check on a few things. We, as a reminder, COVID it was a huge challenge for the system and outreach, especially when our partners were closed, and we understand why, and that made sense for them to not be open. But I just want to remind folks, like, there was like a 2-month period where a lot of our big heavy lift partners were closed, and we are worried about that in the short term too. And I know even some facilities, right, even if it's our West Side shelter, but I think too in Matt's, I'm not sure, is Matt's open at this point or remaining closed? Just wanted to check on that. I don't know if anyone from the county might have an update on that.
Mr. Mayor, Jim Colley, Matt's, the new care facility, is open for business and is working hard and is responding to requests. And County Manager may want to improve on what I just said.
Hello, Mr. Mayor. Hello, everybody. Actually, Margarita's on the call. We're in this meeting. And so, yeah, our services, we're not accepting new clients at this time, but I'm going to let Margarita go ahead and give you all a little report. And thank you for asking about that.
Good morning, everyone. Can you hear me? I think I'm unmuted. Yes? Okay,
yes.
Great. So yes, thank you, Julie. Thank you, Mr. Mayor. We on the CARE campus have remained open throughout the entire pandemic. We had to decrease our census due to social distancing, but we have remained open. We had a little COVID scare last week, and so we are temporarily closed to intakes until all of our results come back. So far, so good. Every result has come back negative, but we are hoping to reopen to intakes actually later on this afternoon, pending 2 results. And so other than that, we are open and in operation on the CARE campus.
Very good, thank you. And we will kind of weave this in as needed, but we're keeping a close eye on our partners, obviously, with St. Martin's and HopeWorks and challenges around there, especially with the sort of overflow that we discussed, having to spread out of the West Side shelter. So anyway, that's great news, and hopefully it'll be back up soon.
Mayor, if I may add, I think as COVID hit, you're right, there was a kind of an alteration on the opening of providers, but providers, as they were figuring out COVID, did their best to continue to try to outreach to our providers and even to outreach to people in need of services. Deputy Uval continues to have ongoing meetings with those providers, and given now that we've got this uptick in COVID cases and we'll begin community testing, we'll have one of those ongoing meetings today to discuss how they're doing in the face of this uptick in cases.
Okay, anything else on this item? All right, Carol. Unless you
Okay,
got-
so moving on to housing. So as we all know, we have two very important housing committees, and as we've all talked about, this is a seesaw. As we talked about services and emergency shelter beds, very important, but we've got to equally address the housing need because they go hand in hand, and it's a balancing act to make sure that our ultimate goal is to get people into housing and the best thing that meets the best situation that meets their needs. So for our housing committee, and right now, who do we have here for housing? We've got Lisa Uval, one of the co-chairs. I'm not sure if, yes, is Betty here from the county is another co-chair, and Mark Childs with UNM. So the high impact strategies identified is overall creating a strategic plan that looks at housing affordability. And this is a whole wonderful comprehensive view on what our community needs, the wonderful work that we have already on the study that was done really helps launch that to having that strategic plan. The increase of supply of permanent supportive housing vouchers is needed, and that's one of the high impact strategies. This is where it also, we do need to look at the pipeline for those to see what we need to do to expand in different ways and how we work with landlords to achieve that. And also we need to increase the supply of housing vouchers as well for low income tenants where those rapid rehousing. And the same thing applies there. We need to look at the pipeline to see how we can expand that to employ some other creative thinking and how we work with our existing providers and landlords to make that possible. How affordable housing developments with ongoing rental assistance through housing vouchers is something else this committee is looking at. Really important. There's some good examples going on in our community, but it's not enough. We need to do more. And continue to collaborate with the Albuquerque Housing Authority to make sure that the limited preference for Section 8 vouchers for supportive housing tenants is fully utilized. So underneath that, there are some other detailed strategies, but I'll stop there to see if Co-Chair Uval has anything to say, because I think you're the only co-chair here. Lisa?
Actually, we did bring Betty and Mark.
Oh, and Betty and Mark, thank you. I'm glad David brought you in. So we'll hand it to those three co-chairs to see what they would add.
Carol. Well, I think that was a good summary. I don't have a lot to add. I will say we really based our recommendations on the recommendations in the Urban Institute report that was commissioned earlier this year. And that report was quite clear that housing vouchers, either just permanent supportive housing vouchers or just sort of ones, just housing vouchers without the supportive services attached, are a very effective way to address homelessness and affordable housing needs in our community. So I think that really makes sense. That will be a place that our committee will continue to focus, and that does mean looking at existing capacity as well. Yeah, I think that's what I want to say.
Wonder if Betty or Mark Childs have anything to add to this important work.
No, I think Lisa said it all. Thank you.
And I can add my thoughts that Lisa said it all.
Can I add one thing?
Yeah, thanks. A little bit more, Lisa. Yeah.
Yeah, I just want to say I've been doing this work for many years in our community, and this is the first time that I've just seen that all the right players at the table talking about affordable housing and developing this very concise but comprehensive strategy. So to have the MFA, the city, the county, UNM with their sort of academic and research lens, housing authorities, supportive housing providers all together. I just think this is a really amazing time in our community that we have all these folks thinking in a collective way. So very excited to be part of this work.
Awesome. Great to hear. Good work on that.
Thank you. And I think that same spirit that Lisa's talking about that we've certainly witnessed and all of the committees just coming together with the variety of perspectives is very helpful. And that also is very present in the youth housing continuum. So this is a very dynamic group addressing the needs of our young people ages 18 to 25. The needs and gaps are highlighted and are very notable that this is often a hidden population because they may not be seeking shelter in existing centers because they can also be preyed upon by adults. It's a vulnerable population that we need to really lift up and address their needs. So this very dynamic group has identified 4 core high-level strategies. One is conducting a youth housing community needs assessment to fully get a grasp on the needs. And just to go back to the other committee's report with the Urban Institute, the Urban Institute report that Lisa referred to really launched that committee on some great data. And so that is what our youth housing continuum needs to do. They're really all ready to go. They're already beginning the next step by putting a cost to that and identifying what it would take to move that forward. So they're kind of leading the way on some of these next steps. A young adult shelter is what's needed, ages 18 to 25. And I want to show that while the committees are working separately, the facilities committee also identified that population to make sure there was a facility for that. And in turn, our youth shelter group identifying that's what we need to do. And I think just so folks know, I know I've heard some of the conversations, we're talking something maybe 20, 25 to 30. It's a small shelter. And I think we can never overemphasize the size on these shelters. So we're aware of what we're talking about. UNM and CNM subsidize and specialize student housing. And so great to see the co-chairs on here, Jen, as well as Quinn's here, and Asada as well. Really some dynamos in looking at some of the UNM data to really what can we do to support UNM and CNM students so they can pursue their education, but to have safe housing. Really quite a notable study that they have highlighted on the need for housing for those students. And then last, permanent supportive housing vouchers for young people with complex behavioral health needs. I'm sure, as you may have noticed in the needs and gaps, often if on the onset of schizophrenia for young people, they're vulnerable. They've got to get the help they need, whether it's schizophrenia or something else. And so this is really an important area that we need to look at for behavioral health needs. I just have to say personally, when our community addresses our young people in this way, we will be a better community and have done a very important thing for the future of our community. So with that, we've got co-chair Quinn, we've got Asada, we've got, I think it's Nasha as well as Jen. And this is quite a dynamo team. So I wonder what they would like to add to this.
Quinn, go ahead.
Sure thing. I will start off by just mentioning there's 2 little updates to this document that I just want to throw in that you'll see that on the youth housing needs assessment, we have an approximate cost of $114,000. However, that's been upped a bit. There's 2 different options for cost on this, between $250,000 and $300,000, but we can, when we get into our next steps, we can talk a little bit more about that. Also, I did want to mention that the permanent supportive housing vouchers, they are really essential for this age group because there is such a drop-off, a dramatic drop-off in service between ages 21. At 21, things really shift for young people. And so what happens if a young person has early onset mental illness, such as schizophrenia, they often fall between the cracks. And that's something we really want to work to avoid. And also part of that should include supportive service money, because as it was already highlighted, the capacity issue is through and through our total community, not just with adult providers, but also for youth providers as well. So that should be a part of that. And so that's what I'll say, but I'm sure Asada and Nasha and Jennifer have great things to add.
I feel like you've covered it pretty well, Quinn. Thank you so much for updating the numbers. I will clarify that we do want to do an enumeration of all youth ages 15 to 25, so we can have a sense of the youth that will be moving into that 18-year-old group.
Thank you for that update, Asada. Yes, the 15 to 25 is essential because we do want this assessment to be able to be used by our community. So we do want to be able to have numbers that reflect younger people and also older younger people so that all folks can utilize that assessment. Jen or Nasha?
I don't have much to add. You did great, Quinn.
All right, thank you.
Commissioner O'Malley?
Yeah. Commissioner O'Malley?
Thank you, Mayor. And I don't think Julie was a part of this meeting at the time, but I know we had a meeting with CYFD representatives and also someone who's working with them on a larger scale, national scale, to address the challenges with homelessness when it comes to youth, especially folks who are young people who are now leaving foster care, for example. And they had a lot of information. In fact, they had some access to, I think, some federal vouchers, but they were looking for places. In other words, buildings, places like that for housing some of these people. So I think they've done a lot of work in this area. We need to reach out to them to find out what information they have. I thought it was pretty comprehensive, what they had in terms of their assessment of what was needed. Just wanted to throw that out there so that maybe we're not duplicating any efforts. Thank you.
Commissioner O'Malley, thank you so much. And those folks that you mentioned are actually on the committee. So that's really great because they did bring up that meeting. And those studies that they have are very helpful, but they do have some limitations because it is very much systems involved youth, which is a lot of our data for young people is focused around foster care system, juvenile justice system, and occasional some behavioral health numbers too. So what we're trying to do is really broaden that scope. So we're counting as many young people as possible and not just having the overrepresentation of systems involved youth. Does that make sense?
That was okay. I was just wondering about that because sometimes I'm just thinking about the resources for a study, etc. And is that I just was bringing that up. Is it needed in terms of that? And if you say it is, I believe you. I just thought that there was a lot more data and information out there.
One of the problems with the data that exists is that not all youth are counted. Some of them are double counted. We have discovered at UNM on the basis of a survey that was collected back in the spring that we have something like 2,000 individuals who are housing insecure. And the number should be about similar at CNM. And so many of those youth are not being counted in the systems involved numbers. The other thing that was pointed out by a committee member is that we would like to go after some federal funding to support some of our efforts here in Albuquerque. But unfortunately, we are not eligible to do that because we don't have a good enumeration of our youth. And so there are multiple benefits to this enumeration and needs assessment that we are looking for. One thing I'm really excited about with our HSC partners who have proposed the needs assessment is that they want to create a committee of homeless youth to help them in collecting the data. And so it's beautiful because it helps to build capacity, involvement, something close to my heart as an educator. and, you know, getting that buy-in as well. And so I think it's a pretty exciting project. Thank you.
Thank you.
And Commissioner O'Malley, I did just want to let you know that CYFD is an integral partner in this committee as well. So they're definitely part of that. So thank you so much for bringing that up.
All right. I think that concludes our reports. Any other questions on this section? Yes, Julie?
Hi. So I just, wanted to basically reach out. I'm really proud of our staff, and I just want to say that, there's, I think there's like 3,000 vouchers from various sources that housing has, our Community Connections program. So, as everybody knows, the county, the city, we get funding from federal, state. In our case, we've got behavioral health funding. So we're leased in all those categories, like up to 99%. And this also includes the youth that you all talked about. So please, let us know. Actually, HUD has reached out to our Community Connection program because they had extra vouchers that they needed to get out to the community, and we've done that. So, I think the last time this went in front of our commissioners, our county commission, I think Commissioner O'Malley, correct me if I'm wrong, but I think it was like $500,000 worth of vouchers that were approved and are out to the community. So, let's work together however we can help you all, or help anyone. We want to be a part of what you all are doing. So I know that Margarita had reached out to Carol this morning. It was just barely this morning. So we offer our assistance, however we can help get those vouchers out to our community. Thanks.
Okay, thank you for that update, and we'll connect on that. So appreciate that. Okay, I think we're going to move to our next agenda item, and seeing no hands and whatnot, we'll go into some of our neighborhoods and outreach updates. And from our end, why don't we start with Lawrence Rael. Lawrence?
Thanks, Mayor. So as we had talked about at our last meeting about 2 weeks ago, we talked about the next step in this process as we're getting to a point of solidifying this report that Carol just reviewed with all of you, is now beginning to have the conversations with the neighborhoods and the community as a whole, I would say, on the systems approach that we're presenting to you all, and that we've all have been working on for some time. Many of you elected officials in particular have been very clear to us that you'd like to make sure that the community has gets an opportunity to comment on this document and to have additional input as it relates to other matters that we may have not touched on, or that we need to do further work. And so I think at the end of this week, we would have been in a place where we are going to finalize this document so that at our next meeting, which is on what date? Well, it's right here.
It is the 27th.
We'd like to make sure that we adopt through this process, this report, and if we then start setting up the conversations with the community about the report and ask them to give us their input as well. And here's the point. The point was that we needed to make sure that all of us collectively as a council, that we were all up to speed and that we concurred with the recommendations that were made by these individual committees, so that as we have the conversations with the community, we're all sort of speaking from the same level of baseline information. That we're recognizing that these are the issues. We're recognizing these are the capacity needs in the community, and that we're going to begin to have a process to address some of those issues moving forward, whether it's additional facilities, whether it's additional street outreach programs, whether it's you name it, as it relates to what we've got in this report. So I wanted just to sort of begin to have that conversation with all of you. We don't need to make any final determinations today because this is a bit of an evolving process, but I would encourage all of you to either send me or Carol Any thoughts on this approach to having this document reviewed by the community? And then, as the mayor said earlier, as we start looking in particular, we all know that as we start looking particularly at facilities and facility locations, there'll be a lot more community input simply because of the process that we all live under in democracy. So we know that that's going to happen, but I think it's important that we also present this document as a comprehensive review so that the community members know that we're not just making decisions in a vacuum, if you will, about a particular building or about a particular program, but that it's much more comprehensive. And so love to hear your feedback on that approach. And if you have any thoughts now, if not, we can obviously take them over the next couple of weeks.
Okay, thoughts, remarks from folks? Commissioner O'Malley?
Thank you. I think it's sometimes from what I'm hearing from people in the community who are affected by location of services is that they're not really always clear on what their role is. So is it to give some advice to because I think that sometimes they get frustrated and as I said at the last meeting, sometimes they're like, well, you're not listening. And I'm like, well, I am listening, but I don't always agree with how you feel about things. And I've made that very clear to some of the people that have contacted me. And, and I've been very clear that I think we need more services. And of course there are conditions around that. And so I think it'd be really, it helped the folks who want to weigh in on this issue to find it, to give them a very clear parameters on what it is they really have effect, what they can affect really. Because ultimately we have to take responsibility. We're the decision makers. And we're going to make decisions sometimes that not everybody agrees with. And that's going to happen. So I think that somehow we probably had to have that conversation about the role of neighbor associations and individuals is really what real, I guess, for lack of a powers do they really have? What is the role? I think that they would like to have clarity around that. Thank you.
Mm-hmm. Good point. Others on this? Okay. All righty. Anything else on that, Lawrence?
I think we're good. We'll continue to have, I'll reach out to all of you individually as well as Carol and get your thoughts. But Commissioner O'Malley, your points are really important. We just got to make sure we do set up a process so that as these issues do become public, we've erred on the side of getting some input and not been doing sort of making decisions in a vacuum, if you will. So thanks for that.
Mm-hmm. Very good, and good point about the expectations. I just want to echo really what Commissioner said in the sense that I mean, look, we all know what we feel when we're in that situation, and I think there's a lot of room that we've seen in the past, whether it's good neighbor agreements and things like this, where we can really incorporate input in a meaningful way, but also really respect what you mentioned, Commissioner. At some point, it is our job to make a decision one way or the other, and so we don't want to lead on neighborhoods and sort of say, well, actually, you decide, right? I think that can often lead us all down the wrong path, and then of course ultimately they're let down. And so we'll try and be pretty clear on that going forward.
Thank you.
Okay, and Councilor Benton?
Yeah, just quickly on that, and I kind of, Mayor, you were probably spared my previous diatribe about some of the issues with the frustrations of the neighborhoods, and they're largely at this time from my council district. But yeah, just hearing from earlier, I think, Mary, you may have missed it, but somebody from the Friends Meeting House spoke to us under public comment. And I think although the Friends Meeting House is an institutional neighbor, it's similar to the frustrations of other neighbors, of residential neighbors and businesses. of just feeling, they do feel left out, and they do, they're frustrated, as many of us are, with the challenge, you know, but what I've tried to explain to them is that this effort that is represented by this meeting right now is the best coalescence of the right people to put our minds together and tackle this, and that there is hope for these neighborhoods if we do this right. And but I totally agree with and echo what you, Mr. Mayor, and Commissioner O'Malley just stated about this is a sensitive issue, but it's also one where, you know, elected leaders have to step up and stand behind the effort.
Appreciate that. Thank you, Counselor. Other comments on this? Okay, we'll proceed forward. And again, I think after next week's or the next meeting too, we're going to have a lot of meat and potatoes to go over, you know, with neighborhoods after that. So we can really kind of put this into play after I think in 2 weeks. Okay, so with that, let's go ahead and move on. I know the next agenda item we had was the housing vouchers, but I know we covered this a little bit. Carol, do you want to add anything else on that?
Sure. And if I may, just to go back to the next subject.
Carol, let me just, this mic is amazing. So you can leave it in the center.
Oh,
and
I
it'll
can?
still pick you up.
Even me?
Yeah, even you. You do not have to shout at it right next to
Thank you for setting me straight there. The mayor's homeless advisory council that was established 2 years ago, they will have their meeting on Thursday. Deputy Duvall leads that with others, and we will be taking this draft document that you've reviewed today, and I think that kind of begins that process of providers and neighbors that may not be participating in committees to see that, to provide some input. In terms of the housing vouchers, yes. As we talked about the high-level strategies, housing vouchers are key to our collective success to house homeless individuals. And as all the providers doing housing vouchers know, that often there is a waiting list, whether it's the county, the city, also using our coordinated entry system, we have big numbers on that list, and that's what we need to be more assertive and aggressive in getting those numbers down. So I'm excited about the work on the committee. In terms of the city specifically, yes, we are looking at other and new venues to open the pipeline, if you will. We have really 10 excellent providers that we work with to address housing vouchers, both the rapid rehousing and permanent supportive housing. We are meeting with them tomorrow to understand parts of the system that can be improved, but we are going also looking at other creative solutions to look at how we can really address those numbers on the waiting list to do something that can get those vouchers out more quickly. That includes looking at the supportive pieces that always need to accompany that. So right now, in fact, one of our team members, Myra Siegel, has the list from the homeless, the Coalition to End Homelessness, to look at that waiting list, to do some analysis to see what are the levels of needs there, to see if we can kind of put them in some categories to see what we can do really rapidly to get people housed. So Councilor Davis, I appreciate the meeting that you helped set up yesterday with the New Mexico Apartment Association. I thought we had a really productive, good conversation. We're building on that as we speak. And I think as we, the city, move forward, we know then, and I appreciate County Manager Morgus Baca mentioning Margarita reaching out. I think as we all share some of the challenges on waiting lists, how we will collectively work together, and we'll be working on that here at the city and reaching out. So thank you.
Okay, any other questions on this point? I think we touched on a little bit before. Okay, why don't we touch on just if there's anything else that needs to be covered. I know you mentioned a little bit too, but just on our recent, COVID challenges at the West Side Shelter. Anything else you want to add on that, Carol?
Oh, I always want to add that. Thank you, Mayor. No, it just, this partnership has only gotten stronger through COVID. The partnership existed pre-COVID. I'm grateful for that every day. And as I did the big shout out to the university, and not only when we work with the Department of Family and Community Medicine and the physicians there, what they do bring to the table are medical students, our public health students, are all those folks that keeps adding to our bandwidth to address this. And they're over at some of our non-congregate sites today, helping us with data collection. It's giving UNM students really great new opportunities to learn really what does public health mean, because we are living a public health response here. So while it's the Department of Family and Community Medicine under the Health Sciences Center, we just couldn't do that without all the other avenues and arms that reaches out to on students. So we're grateful for that. And we're just grateful for a really good, strong partnership with the state as well. So always want to add that. So thank you.
All right, appreciate everyone's help on that. And as we've seen and mentioned before, this probably isn't going to be the first time. In other words, we're in it for the long haul, and part of building our resilience as a community is being able to deal with these in a fast and effective way. So, as Carol has mentioned, it also demonstrates the need for, additional facilities and services as opposed to driving out there to the old jail. So, okay, I think with that, other items from folks? Okay. And I think we're right about on schedule, so we'll look forward to kind of our deep dive in 2 weeks. And, seeing no hands or comments, I think we'll go ahead and wrap up and wish everyone the best and stay healthy and hang in there. All right. We will see you in 2 weeks. Take care.
Thank you.
Bye-bye.